Colorado reports the first known case here in the U.S. of that highly infectious UK variant of the coronavirus. The U.S. now reporting on average more than 180,000 new cases over the last 7 days. Let's bring in Dr. Cameron Wolfe. He's an infectious disease expert and associate professor of medicine at Duke University School of Medicine. And Dr. Wolfe, it's good to talk to you today. Let's start with the news on the vaccine here from AstraZeneca and Oxford. We're still waiting FDA approval here in the U.S., but there certainly does seem to be more hope riding on this one, largely because there aren't the kind of limitations we saw with Pfizer or Moderna in terms of the storage issues with the higher temperatures. Okay. And also, we're still talking about much lower efficacy with this vaccine. How are you looking at this green light coming from UK regulators right now?
Yeah, I think we're really pleased to see this vaccine moving forward. I don't know that it will have quite the immediate impact in the United States, but globally, this is a big deal. If we had have thought back 3 or 4 months ago that their efficacy of 70%, if that was the first vaccine we had have seen released on the market, in fact, we'd all be celebrating and moving forward with this. That's still a great outcome. I think the challenge in the United States is, obviously, as you say, this still has to go through a few more regulatory hurdles here, but it will be another option. I think it does have the benefit of a production cycle that's a little more efficient than some of the mRNA vaccines that we already have available. And it certainly doesn't have the cold chain challenges that we've seen with Pfizer, where they need to be sort of restricted to minus 80 degrees. So this is a good step forward. We should be celebrating this for sure.
Yeah, it's also significantly cheaper too when you think about $3 to $4 a dose versus some of the higher prices we've seen tied to those mRNA, those ones that require the cold chain that you're talking about there. But in terms of the capacity to roll these out, for a country, as you said, like the U.S. that already has some pretty significant orders and vaccines ready to distribute here, it seems like the issue is now more in getting those vaccinations into the arms of Americans and really having a plan to do that. And it doesn't seem like we're anywhere near the speed to hit that 70% herd immunity level you'd want to see. So what's your assessment of how maybe the plans so far have not gone according to plan?
Yeah, no, I completely agree with you. Like, when we look at the entire spectrum of how we get vaccines into people, I think there's ways to frankly improve on every single line of that. It's distribution to the states, which is a little bit opaque, to be frank. It's ability for states to get it to hospitals where we're currently trying to vaccinate as fast as we can. It's difficulties, frankly, with vaccine hesitancy that still exists in the United States. It's one thing to have a great efficacious vaccine that's available. You've still got to convince people that this is in their best interest to want to take it. We're sort of averaging nationally here about 1 million vaccines a week. To get to 70% herd immunity, we need to have 200 million Americans vaccinated. And so I think it's unacceptable, frankly, that we're on a timeline that is going to take us months to years to get to that point. We need to be ramping that up to a point where we're realistically getting this vaccine towards herd immunity by the summer, or this is going to perpetuate through much of 2021. We've got to do better at that. I don't know that that's solely a supply issue. That's clearly all the way along.
On that front, we did hear from President-elect Joe Biden criticize the Trump administration's rollout plan so far, saying that we're well behind schedule on that front. He's talked about invoking the Defense Production Act to accelerate the process. Knowing what the vaccination process entails and seeing what's on the ground, to what extent do you think the government can play a role and speed up the process in the vaccinations?
Well, already we've done a lot of investment in trying to make sure that manufacturing is accelerated ahead of its regular schedule. It's clearly moving faster than it would for any other vaccine. But I think you're right. I think there's an investment opportunity there, both in not only production, but I think, frankly, in the distribution and sort of administration side of things too. One of our local shortfalls, for example, is we have a hard time finding enough places and vaccinators to physically get this into the arms of the people who need it. And so I think investment from a federal level can actually be helpful, not only on the sort of the primary factory level, but all the way through until actually setting up sort of clinics where sort of mass administration can then take place. So there are opportunities there, really the whole gamut of that sort of spectrum of administration.
Yeah, Dr. Wolfe, you've been pretty outspoken You've been pretty outspoken about, reminding Americans as to why the vaccines are needed here, because you still do kind of hear in the fringe people talking about, oh, why not just get immunity the other way and have everyone get coronavirus here? Obviously, that's not good because of the long-standing implications of being infected. And we're learning more about that now, not only about the UK variant that's about 70% more readily spread than some other strains, but also a New York Times report was digging into psychosis and the mental impacts of coronavirus here. Some worrying cases there, though admittedly small cases in terms of the number of patients that's experiencing that. But how much really is still yet to be known about the more mental impacts of this, the long COVID concerns that are out there in the medical community? How much more do you still want to know about this, and how much more should we be concerned about maybe in terms of the long run implications?
Yeah, it's a really good point. I mean, I think we should remember that it was a year ago today that the first notification came out of Wuhan of some undifferentiated pneumonias in their intensive care. So the entire length of our knowledge of COVID is under a year. So in answer to your question, there's a lot that we don't know. There are long-term neurocognitive changes here that we don't yet understand. There are issues related to PTSD that we will not wrap our hands around for probably many years. There are implications to genetic variances of viruses evolving more capably the more transmission we continue to have. That's true of any virus. We should expect that to be the case here too. And so for all of those reasons, I think there's just such a huge incentive for us to want to get this under control quicker. And in answer to sort of your original question was about sort of the evolution of natural herd immunity. I think it's worth people remembering that as devastating as this has been, and, we're looking at, I'm not sure of today's numbers, but, we're closing in on 350,000 deaths, I beg your pardon. That's got us to about 20% of the community, in best estimate, infected so far. So sort of natural herd immunity evolution to get to 70%, which would be required to sort of get this under control, is really just an awful prospect. And so really the only way out of that, to be honest, I think is vaccination. We've done good jobs at learning what to do in terms of mitigation, but really vaccine gets us over that threshold. Lots to learn. I don't want to learn that by seeing 70% of people naturally infected. I'd rather this go away. To do that, it's got to be a vaccine.
Well, I mean, especially when hospitals are already at capacity in so many different states. Doctor, we're talking about the positive news with AstraZeneca Oxford today, the very latest vaccine to come online, at least over in the UK. As you look to the next few months here, we have heard the dire warnings from Dr. Fauci. We've heard it from Joe Biden saying the darkest days are still ahead of us. Seeing what you're seeing on the ground there, what do those next few months look like for you?
Well, I think you're right. I think what we're going to see, it's worth people remembering that there's a lag time between when you get exposed to when you get sick to when a proportion of those people get sick enough to need the hospital, intensive care, and then when we see it, heaven forbid, someone pass away. And that whole timeline takes often more than a month. So even though we've had a good impact so far of getting vaccine into the arms of sort of people who most need it, so frontline healthcare workers, and we're starting to move into waves of nursing home facilities, the positive impact on that is not going to take place for a good few weeks yet. And over those few weeks, we've, of course, also had Christmas and New Year, when typically we get a lot more congregation. It's winter in the United States, so people are more huddled and they're indoors and they're closer to everyone. And I think that's going to bear out on an impact that unfortunately will leave January, I think inevitably pretty bleak for hospitals. And the way that we sort of in a hospital system adjust to that is we have to cancel things. Elective surgeries get pushed back. We get more sort of surge pushing. People find that other non-COVID healthcare things get pushed back and deferred and delayed. And there's lots of spin-off impacts of that. So, but I think if you took a more rosier view of this, I think if we can put that investment into actually getting a vaccine rollout much more effectively, we will start seeing the impact of that in the first quarter of 2021. Will it see the sort of dramatic drop away in values by sort of Easter? I don't know, but I'm certainly hopeful for that. But I think January will be a difficult month. I don't think we should sugarcoat that.